Bunions are bony deformities that you tend to find on the corner of the big toe, predominantly more on the left side, but also very common on the right side as well. It's basically as a result of misalignment of the big toe. What tends to happen is when you're wearing poor footwear, or if you have biomechanical issues, the forces that are moving through your foot are not moving through your foot correctly. The forefoot and the rear foot are not in a correct position, so therefore your foot is not able to absorb those forces correctly, and as a result this redistribution of forces causes deformity in the foot. If you have bunions running in the family, it's very likely that you're going to be more likely to be predisposed in developing one as well. Bunions are treated initially when you come into the practice. We'll have a look at your foot, we'll have a look at the area that's swollen and painful. The first thing I like to do is look at the patient's footwear, see if the footwear is wide enough, it has enough depth, and it has enough arch support. If that is not the case, then I would advise them on the footwear and maybe send them away if the pain isn't too bad. If that doesn't resolve the problem and they want to see me again, then what I will then do is do what we call a biomechanical assessment, where we assess the alignment of the foot and look at the arch and look at how the forefoot and the rear foot are connected with each other. If there are some problems, then what we tend to do is we'll fit the patient with an orthotics to correct the misalignment, and also again make sure that they have the right advice with footwear. If that doesn't resolve the problem and they're still in pain, we'd be looking to referring them on to a surgeon to offer them some form of steroid injection. And if that all fails, then we'll be looking at the possibility of carrying out surgery, which is not something I normally recommend, but if all options have been exhausted and there is no other alternative, then we'd be looking at surgery.